Hello, my name is Dr. Tred Rissacher, and I am a doctor of chiropractic, and I'm going to be your host for the next hour here. And I'm going to go over just exactly how low-level laser therapy, the red light, and these near-infrared light devices are helping you to look better, to feel better, to heal faster, to improve your gut microbiome, including just overall fitness. So many things it does. It's mind blowing to me. So, without any further ado, let's let you listen to our intro here.
This Georgia as heavy as I was.
It's called acanthosis.
18+% of our children right now are obese.
How loud are you? About 280.
If you go with the flow in America today, you will end up overweight or obese, as 2/3 of Americans do.
I don't want to be fat for the rest of my life. I've got diabetes,
Sleep apnea.
high blood pressure.
I get dizzy when I get up.
Everything's hurting now.
You don't crave.
Yeah, so that is a fact. We're in trouble. We are getting bigger and bigger as a nation. Your life and your health depends on having proper energy and proper body weight and proper nutrition and sleep and vitamins and minerals. And, so many of those foods and those good, healthy habits seem like things people do just because they have to. They're not doing it because they want to or they understand, the end of life. As I get older and older, I'm 63 today. I realize that a lot of the decisions I made when I was younger, even though I was a doctor and I knew better, have led me to be dealing with some health problems. And now I don't want them anymore. And I'm working hard to get rid of them and to heal from them. And I'm hoping that by sharing my story with you, that you'll understand more about just exactly, I'm no different than anybody else. And I've dedicated my life and my practice and my effort into helping people to overcome these very simple problems that begin really just from, I don't want to say bad habits, but not understanding proper food and nutrition, and that there is help available. And so my goal as the chiropractor, as a doctor, is to help you with that information, to get you on a better path of healing and help. So if you're over 50 or 60 years old, or even in your 30s or 40s, and you're starting to gain weight, especially abdominal weight, it's a very dangerous spot to carry weight. Abdominal weight, fat around your midsection, is hyperinflammatory. It creates lots of inflammation. It's also, it drags down it increases the stress on your heart. It puts a lot of stress on your joints, on your knee joints and your hip joints and your back. It also affects your ability to sleep better. I mean, people that have lots of extra subcutaneous fat or belly fat, they're acting like they're okay in so many ways. They hope to get it off eventually, but a lot of you never do get it off, and you end up living with it. And eventually, then the health crises come. High blood sugar, the high glucose, fasting blood glucose, the triglycerides become elevated. Your blood pressure starts to crank up, so you might be being put on some medications for blood pressure. And there's so many areas with weight that make us sick and can affect our health, that my goal has been to get to the cause of the problem not necessarily treat all the side effects and the conditions that arise from carrying too much body fat. Uh, you know, it's why would you treat the symptoms? You know, if your car had hit a pothole, you know, in the old days before they had the skid plates, my BMW hit a pothole. I remember it. It busted the oil pan and the oil leaked out, you know, while we were driving. And, you know, the oil light came on and I knew that was important. And I didn't just, you know, try to put more oil in it. I stopped the car and called the tow truck because I knew there'd be serious damage if I kept driving the car. Yet when we have these symptoms, you know, of high blood pressure and high blood sugar and neuropathy, tingling, we get to this point where we don't really get to the source as to why it's happening. We really rely on symptom relief for that, you know, medication, a good health insurance plan, creating a scenario where we don't have to stress ourselves too much, you know, as far as comfortable chairs and shoes and different things. As we learn to adapt and accommodate this extra weight, this you know, moving into obesity. And over time, it can make us very, very sick. And when you finally realize, or somebody points out to you, or you come to the understanding that this is because I'm carrying too much body fat, or I'm not exercising enough, or I'm not eating the right foods. And as a result of it, you decide it's time to do something. But oftentimes it's not too late, but it's not as effective as you had done it 10 or 15 years before. And, you know, I do this talk a lot. I speak to a lot of people about weight and weight gain and where they are. And as I'm at some of these shows I'm at, I watch the people walk by and they act like there's nothing really going on. It's not a problem. You know, I'll get to it later on. And then you find out that later on it's a permanent condition. And yet they still think they can bust a move and drop that weight. And when they do, oftentimes the first thing that happens is, yes, they can drop the weight, but they look much different than if they had maintained their weight their whole life. In other words, they can end up with loose skin. So if you're fortunate enough to be in your 50s or 60s or 70s and you manage to lose 20 or 30 or 40 pounds you've been carrying around since you were in your middle age, you're going to be in a situation where you're going to have loose skin hanging off of you, hanging, you know, around your arms, around your neck, around your face. And that is, a lot of people don't want that. They don't want to have that loose skin. Not only that, but the metabolic syndrome, the health condition, which is aggravated by not eating properly and carrying too much body fat, that, you know, those chronic problems, which lead to, it can be as much as dementia. It can lead to stroke. It could lead to heart disease. It could lead to atherosclerotic plaquing of the arteries. It can lead to high blood sugar, which means glycolization, where the glucose is actually rotting and causing your nerves and your body to be sickened by the extra blood sugar. These things, they just don't go away that easily. In fact, what happens is now you're on medications to try to stop and slow the process of that down. And it doesn't ever go away. It gets worse for many of you. And the hospital's full of them. I talk to a lot of people, and sometimes when somebody, you know, I have a machine called a body impedance analysis. It's a BIA, they call it, body impedance analysis. And what it does is it checks your body fat percentage, your resting caloric intake, how many calories you burn at rest, so you know your food intake. And it also calculates your hydration, how hydrated you are. And good health is a body fat ratio of 20% fat and then 80% lean muscle mass. And that ratio of having 20% body fat and 80% lean muscle is a fantastic ratio to attain to. It's a goal that everybody should be seeking, to have that ratio. And that 20 to 80%, now understand that 20% is definitely all fat, but the 80% is really what they call lean muscle, which is everything that's not fat. So it's muscle, it's bone, it's water, it's minerals, but you want that ratio to be 20-80. And it doesn't matter what your scale says. If you have a 20% body fat and 80% lean muscle, you are considered of a normal weight. And you shouldn't be shooting for the scale to change that scale unless your body fat is high. And when your body fat starts to get higher and higher, from 25 to 30% to 35 to 40%, we call that obesity. And now that same body fat now is making you sick because it starts spewing out inflammatory molecules. The fat becomes its own sickness, its own disease process. And it's well documented. There's lots of studies on all the different hormones that the fat produces. And those hormones that fat produces, when we only have 20% of our mass, those hormones are very important and they're necessary for life. There's a hormone called estradiol or estrogen. Your body fat produces estrogen, just like a female's ovaries and a man's doesn't have ovaries. We produce body fat from our fat. Well, women produce fat from body fat. Estrogen from body fat also. Now, because that's one biomarker that fat produces, which is estrogen. And if you have too much estrogen in your body, you become what we call estrogen dominant. And estrogen dominance leads to ill health, and over time, feminization of men that are estrogen dominant. When they have the belly and they start to get the male boobs, and they become feminized. In women, it turns into aging prematurely, thin hair, thin skin, vaginal dryness, not feeling well, having ups and downs on emotions, eating to feel better. That's another big one of estrogen dominance. When you have too much estrogen compared to your normal other hormones, we become very hyperactive. It can lead to adrenal fatigue syndrome, where your adrenal glands are starting to fail, and adrenal fatigue is tiredness and lethargy, and other bacteria start to populate in your body. Yeast, candida, these things all are opportunistic when we're starting to carry around too much body fat. The other incidence of body fat is just plain old, just a taxing on the heart, on your ability to pump blood through your body is affected by body fat, because of the heart is now having to move blood through massive amounts of adipose tissue instead of feeding the organs and the muscles and the vital centers with blood. A lot of it is going into the fatty tissue, and that leaves you deficient in the other areas, which is not a good thing. It's a disease. And some of the other issues that come on with too much body fat is it actually creates, it can destroy your microbiome. It affects your gut, the normal bacteria in your gut, which are necessary for life. We have a relationship between them, what they call the gut microbiome. And you might have heard about it because a lot of people take probiotics to replenish the gut flora, the natural gut flora, which can be damaged by foods and poisons, and carrying too much body fat too can damage the gut flora. And then now we have a microbiome problem, which affects your energy. It can cause chronic fatigue syndrome. It could cause autoimmune problems, arthritis that comes and goes because it's inflammatory. And anytime we have chronic inflammation in our body all the time, we become ill. And, you know, medicine is mainly treating, at this point of our career as humans, medicine is mainly treating symptoms, symptomatology, secondary to bad food, bad habits, not exercising properly, not avoiding poisons and toxins, like smoking and being exposed to toxins and poisons. Some we take voluntarily, some we're exposed to, like petroleum products. And as these poisons and this lack of health energy and the not moving and the not drinking enough fresh water, as these start to accumulate in our body, we become ill. We become sickened. And then we need symptom help. We need treatment of those symptoms. We need somebody to help us. We need, we feel we need pills. And they've done a very good job at educating you and making you believe that drugs are the answer in many ways. Of course, you'll still get a sheet of paper like, this is what you should do to exercise more, but nobody's really helping and putting in the same amount of effort when it comes to being healthy as they do and being sick. So this is something that I've watched and observed as a chiropractor for many years. And I didn't, I've adjusted thousands and thousands of people with chiropractic and help with alignment and help them with posture and exercises and getting the right beds and the right chairs to sit in for their spine. And what happened is I became the guy with too much body fat. And I was shocked when I found out how much body fat I was carrying. It really, really blew at the time, other than diet and exercise, which everybody knows about, but few are successful at doing it. Hello. If you're over out there and your belly's hanging over your gut, or you're heavier than you want to be, maybe diet and exercise didn't work for you. We all know about it because it's very confusing. So what happened to me was I got married 14 years ago. Actually, my anniversary is coming up, Christmas Day, 25th. I'll be married 14 years to a beautiful young lady who helped me make some better decisions when it came to where I was going in my business. As a chiropractor, we deal with people that are in auto accidents, worker comp injuries. Maybe they picked up something too heavy. They've strained their back. They sprained their knee. It's really musculoskeletal pain. And I like to think that a chiropractor gives a better choice because we don't recommend pills right away. Although I don't suggest you don't take any medicine. If you're in a lot of pain, you should. But you got to get to the source of the problem, why it really happened. And I've always felt that's what a chiropractor does. At least that's what I've always done, is look at the source, look at the cause, treat the symptoms, at the same time, address the cause. And that's very, very different than the allopathic model, meaning the medical model. The medical model is basically, rule out that you're not going to die from the symptom you're coming in with, make sure it's not life-threatening, right? That's why they take x-rays and MRIs and CT scans and do all the diagnostics that they do. They want to make sure that it's not something you're going to die from, I guess. And then they treat the symptom. And then if it's something that they can address as far as the cause goes, maybe it's, you're drinking arsenic and maybe you should stop. Or maybe you're the sport that you like to do is creating chronic injuries, and maybe you should look at that. Those are some causes. But when it comes down to, food and habits and stress and hormonal profiles, they really don't have a lot of information on that. Medicine has become very compartmentalized into, what drug matches this condition you have. What is the best pill for what you're showing up with today in my office? And they're not really looking at your whole body. They're not looking at all of your systems, your glandular system, your nervous system, your eliminative system, your digestive system, your muscular system, your circulatory system. All of those systems, there's 6 of them, have to all work perfectly in harmony to give you health. And if one of those systems, the glandular or eliminative or nervous or digestion or muscular system gets disturbed in some way, and we could sit down and talk about all those disturbances, what'll happen is you will start to show symptoms. You will start to show problems. And those symptoms, there's a whole book. There's 10,000 medicines and diagnoses for all of the symptoms to relate it to a pill or a drug or something that, comes from the pharmaceutical industry. And since the drug industry, which is giving you drugs, is not in the tissue repair and the healing business, they're in the symptom treatment business, you end up with a bad bill of goods. You end up with a product which can be harmful. And as I sit back and I think about this, I realize that the harm is really, one of the side effects of body weight, of carrying too much body weight. That is a symptom of a lot of other problems. When people come into the spa, into my weight loss program, you will always ask them, do you think, they tell me they have they have all the body fat. They want to get rid of the belly so they look better and feel better. But then you go into the fact that they're on medications. Maybe they're on blood pressure. Maybe they're on triglyceride medication. Maybe they're borderline hyperglycemic, starting to have neuropathy. And I asked him, I said, do you think that the fat caused these problems? Or do you think, that led you to be unhealthy? Or were you unhealthy before you got the extra weight on? And, 90% of the people will tell you that I was healthy and then I started to put on weight. And after carrying this weight around, I developed these symptoms, these health problems. So it seems that the weight caused the health problem, because it's linear. I was healthy, I put on the weight, and then I got sick. Now, here's what I would tell you. You were sick before you put the weight on. Yeah, I mean, now you might not have been sick like you are with having the weight on, where your blood pressure is up and your heart's pumping so hard to get perfused. But the illness before was habits, not exercising, not eating enough good, nutritious food, taking toxins. You think you can get away with it when you're younger, 20s, 30s, teens, 30s, right? And maybe you're under an enormous amount of stress. You've had anger issues for years that you never really addressed. And these underlying principles of health and healing lead you to gain weight. That's when the weight starts coming on, because let's face it, if you were really healthy, if you were 100% eating right and exercising and having proper spiritual thoughts, and you're in a job that you loved and you had a family and things were just perfect in your life in so many ways, you probably wouldn't put on that weight. Weight occurs because of problems, because of stress and other things like that. And then we get the sicknesses that come with being way overweight. And that would show up as the metabolic syndrome. Okay, and this is hugely important about metabolic syndrome. Give me 1 second here. All right. I have a timeout on my camera. It times me out at 30 minutes, and I'm not going to get caught by that again. So, all right. So to get back to this weight issue, why this is happening, it again, you can't just treat the body fat. You got to look at the overall person and what they're bringing in. You got to look at the exercise. You got to look at the food. You have to look at the stress they're under. You got to look at, how they've taken care of their health and what their habits are. And it's very comprehensive. This is why so many weight loss programs fail to really maintain health. And the other reason why weight loss programs suck, in my opinion, is they're not really doing anything to really get rid of body fat. In the beginning, for sure, they're not. Over time, if you stick with it and manage to maintain what they teach you over years, yes, you will burn body fat over time. But in that first, 30 days of semaglutide or 30 days of phetamine or any of these drugs that are appetite suppressants or change how you digest food like orlistat and cause you to poop out undigested fat and these different ways they trick your body into losing weight, you're really not losing fat. You're losing muscle tone, and stored energy is what you lose. You can change. Somebody can cut out, let's say you're having a diet that's high in processed food. You like processed food. It's easy. It's quick. It's fast. I can grab it on the run. But processed food is probably the number one source of most illness and disease that we suffer with in these industrialized world that we're in today. In this nation of that we think we're so evolved, but we're eating food which has no nutrition in it at all. And then we wonder why our bodies are getting sickened over time. So processed food is a major problem as to why we develop this inflammatory response and we end up in this metabolic syndrome. And the side of, the obvious thing you look at is you're fat. So, it's important that you get the fat down, that you do something to reduce the amount of body fat you're carrying, not necessarily your overall weight. The scale as a tool to determine your health and wellness is basically can be very slanted, and it isn't giving you the truth. Just because you lost weight doesn't mean that you've been any healthier. It doesn't mean you've done anything to manage better health. It doesn't mean that you have less body fat. In fact, most of you will get more body fat, but lose muscle at the same time. So I'm not making this up. I do a machine at my office called a body fat analysis. It's called a BIA. And the body fat analysis is a machine that tells me how much of my body is fat, how much of my body is muscle, how hydrated I am, my overall, what they call your biomarkers. And from those biomarkers, you can determine just exactly how healthy you are. Now, I have it actually right here. Let's take to this piece of paper. So this is my own body fat analysis that I did here. I don't know if I can put that up there. So that's Tred Rissacher. And it's kind of hard to see the numbers, but I will tell you what they are. It shows that as a male, 62 years old, this was a year ago, I was 72 inches, which is 6 feet tall, and I weighed 225 pounds. My weight to lose was like 8 pounds. My overall fat mass, how much of my body is body fat, is 25%. And it should be, between 20 and 25. So that's a pretty good number. My total body hydration, how much water I have, is 58%. It should be 60. So I could have done better on that. I was a little dehydrated. And, these are my actual numbers done off this machine called a body impedance analysis. And it's really important because without it, I'd never know exactly my numbers. And you need to know your numbers in order to be successful at losing weight and getting weight off. All right. So this is what's so important about body fat. So why am I explaining all this to you? Well, When it comes to losing weight and getting rid of body fat, there's a few options you have out there. We all know about diet and exercise. There's no doubt about it that it works. It's predictable. It is something that we know is part of the formula that will always work. It's called calories in and calories out. Nobody's going to deny that. I would never deny that and tell you that putting a laser on somebody's body fat, because that's what I do. I use a laser to treat the body fat. So I use a laser that's not going to take the place of diet and exercise. Those are laws. These are physical laws of health and healing that you got to move your body every day in every way. You need to move your body, and you got to have good nutrition. It's that simple. Now, a lot of us fall short on good nutrition and also the law of movement because, it's just habit. It becomes some people have great habits, some don't. And if that's the only tool you have is exercise, and diet, as you get older, it gets harder, a lot harder. And since body fat accumulates because of poisons and toxins and bad environments and stress and unhappiness, and we put on weight when we're depressed, you got to realize that the eating and the dieting, the eating and the exercise is not why this happened. You're eating food, you're exercising, but the stress and these other factors lead to this weight gain. And one of them is hormonal changes. We suffer these hormonal changes as we get older or when we have stress. Remember, adrenal fatigue syndrome. Adrenal is your glands that sit above your kidneys, your renals, your kidneys, and adrenal glands produce adrenaline and norepinephrine. And that's the fight or flight hormone that kicks your body into ready to go for a fight. And it raises your blood sugar. It causes your systems to go into a fight or flight, which is a panic mode. All the blood is shunted from your digestive organs to your muscles. You'll empty your bowel, right? You don't want to fight with a bowel full of poop. You wouldn't be able to run. And your long-term memory, the things you think about, like algebra equations or where you want to go next week, those thoughts are gone, man. The only thing you're thinking about under stress is, am I going to survive this moment? And also your overall immune system, your innate immune system and the adaptive immune system, they stop functioning for the most part when you're fighting in a state of flight. What's happening is your body is pumping blood clotting factors into the bloodstream to thicken your blood in case you get a cut so you can clot. It's also causing your serotonin levels to drop way down. Your growth hormone, your serotonin, your endorphins are raised up because you need to be, you don't need happy, I want to have children, I feel so good hormones when you're fighting the tiger or fighting the Fox News or wherever your political persuasion is. This stress creates high blood sugar, low immune system, and then we end up getting sicker and sicker over time. And what it shows up as body fat. Now, I got, my diet, lack of exercise, not taking care of myself. I put on some pounds. I finally topped out about 47 pounds overweight. So if my normal weight would be 200, I was 200 and, 215, 220. My weight in 2012 was 265 pounds. So, I was 20 pounds away from being like 300 pounds. And I didn't feel it. I didn't think I was. To me, it was, I didn't have any symptoms from it. I was starting to get some neuropathy in my feet. I noticed that. And just an overall tiredness and eating to feel better. I wouldn't want to skip a meal. I'll tell you that. If I didn't get food, I was not feeling well. So I attempted, I've done a lot of different things for my health as a chiropractor. I've done fasting. I've done water fasting for up to 2 weeks. I went in my 30s. I went 2 weeks without eating any food, just drinking water. I had read about fasting and I wanted to see what it was like, and it helped me. I felt better. I've also done juice fasting. I've done 3-day fasts. I have, but when it came to exercise, going to the gym and lifting weights and dealing with gym, the type of exercise you would do at a fitness center, that just was not for me. I've never enjoyed working out in front of other people. I see, there's too many people that go there just to be seen. And times when I needed to go there, it was very busy. So I've always fallen short of going to the gym. I'm better now. I'm older. I don't care what people think about me. But when I was younger, it was not where I saw myself being all the time. Now I could, exercise and fish and do things, work outside, cut lawn, and never have any problem with the exercise. I just didn't like lifting weights. So I kind of had failed that part. But food has always been a bit of a reward for me. I find food one of the more enjoyable things I look forward to. I still do. And when I was younger, it was even more important. I know that for a fact. I remember that so well, feeling that way, how important it was when I was younger. And so as a result of that, I started to put on too much weight. And it creeped on kind of slowly. And eventually I realized I was in trouble. And it was right about the time that they were offering this HCG. Remember that? Human choriod gonadotrophin, HCG. HCG is a hormone that women produce when they're pregnant, and it's related to storing of subcutaneous fat, preparing for baby. And then the HCG levels go very high when they give birth. And the theory is that HCG is causing your body fat to now be released in a way that you couldn't do it just through diet and exercise. And in a pregnant female who put on 25 or 30 pounds and her human choriod gonadotrophin levels are really high, I mean, way higher than you could ever inject into your body, I believe it's probably true. But HCG, which we all know about, they still sell HCG. It was in injectables and under the tongue, drops. The HCG is supposed to cause your body to burn that body fat, but it required a 500 calorie diet per day for it to work. And that means like 500 calories. That's not a lot of food. So when you're on HCG and you're doing these injections in your belly for the 20 days that they recommend, or you're taking the drops, you're only eating 500 calories. I did not know back then how devastating that is to your muscular health. I did not realize that if you don't eat your normal amount that you eat every day, like my BMR, my basal metabolic rate, my resting caloric intake, how many calories I burn at rest, was over 2,000 calories. My body needs 2,000 calories to survive. If I only eat 500 and I do it day in and day out, I'm not going to get the extra 1,500 calories from my body fat. It's not possible. I'm going to get those extra calories from my muscle tone, from my stored energy, glycogen, glucose storage, and muscle degradation. So every time I ate 500 calories, but I needed 2,000, the difference was made up in muscle tone. And at the end of 27 days or whatever it was, I think it was 20 days of doing the HCG shots, I dropped 24 pounds. I did. It was amazing. However, I was weak as a kitten. I didn't lose 24 pounds of fat. I think I lost like maybe 2 or 3 pounds of fat, and all the rest was my normal muscle tone, my God-given, lovely physique. My muscles were degraded by it. And of course, you're going to jump back once you stop the HCG and you go back to starting eating food again. You're going to build on that muscle back again pretty quickly, especially when you're in your 30s or 40s or 50s. And for that reason, it was a scam. It was a scam. And there's a lot of people that I met that had done HCG and were so gaunt looking. They looked like if you took a guy that was in his 60s or 70s and you put him on HCG drops or the injections, they would lose weight so fast that their skin would hang on like a paper bag, wet bag, hanging off of them and hanging. And that's not what I wanted. So for that reason, I was really kind of frustrated. And of course, remember, I lost the 24 pounds, gained back 30 within like 3 weeks of stopping HCG. And it's real common. You hear it a lot from people, but it happened to me. And I was in a problem. And that HCG, it's a hormone. So it really, it made me a little aggressive. It gave me a body odor. I didn't like it at all. So, and I had a medical doctor that prescribed it for me. Well, at the same time, I'm using lasers for pain relief. You know I promised in the beginning of this talk that this would be all about lasers, and I wrote that in the description. And I want you to know that lasers are incredible. They help a lot of different things. But right now, I'm going to explain exactly how the laser helps with fat loss, not necessarily all the other symptoms. There's so much to lasers right now, red light and near infrared lasers, that you could never even carry it all. And you couldn't even cover it at one time. And I'll show you something about the wavelength of the laser energy so you could see this. So this chart that I just put on your screen shows the visible light spectrum. And what you see here is you see the rainbow. It looks like colors of the rainbow. Well, that's light. When there's water in the air in the atmosphere and light goes through it, it leaves this prism. It makes these colors, and that's the visible light spectrum. So the wavelength that we use to help with health and healing, tissue repair, mitochondria repair, fat removal, fat loss, is in this red spectrum right over here in the 628 nanometers red light to infrared, but really near infrared. There's another wavelength in here called near infrared, right where I'm moving my mouse here. You can see that. And that is the light spectrum, which has been shown that when you shine this light on somebody's fat, it releases the calories. The calories come out of the fat. It dumps them into the body. And that's what it looks like on me. That's the red light device laying on my belly. I'm lying on my back. There's a little strap that holds it on. And that red light is that 628 nanometers red light, which is penetrating into my skin about 1/8 of an inch deep. That's all. It's a very shallow application. It's not going through your body. It's not going deep into your tissues, but it is flooding. It's quenching. It's pushing calories. It's bringing energy in the form of photons, photonic energy, which is light, into the cells and into your bloodstream. So just like if you go outside and you allow the sunlight to bathe your body and you feel better from the sunlight, that's energy is being absorbed by your bloodstream, by your red blood cells, and it's being carried to all parts of your body, and your body responds favorably to that wavelength, that color, and the fact that it's transferred into photons. Now, we get the energy through vitamin D, and through cholesterol, which turns the energy into chemical energy so our body's cells can utilize it. That's why vitamin D is so important. So in order to use a red light device like you see in this picture, you have to also be willing to make sure you have good vitamins and good supplementation and circulation, because the effect of the red light onto the fat cells requires good nutrition and movement, what we call tissue flushing of energy through the tissue for it to work. In other words, it's not going to cause a dead body to lose fat. If somebody, God forbid, should be deceased, or, you're putting it on a piece of steak. I love when they say, oh, it doesn't reduce fat. And then, well, how do you know that? Because, well, we've taken pieces of meat and fat and put the red light on top of it, and it didn't reduce the fat. You're like, well, there's no life. You got to have tissue metabolism. You have to have function for energy for the light to work. That's like putting diet food on a piece of meat and expecting the diet food to make the fat shrink on the meat. It's dead. So in order to reduce fat with lasers or with these red light devices, you got to deal with metabolism. You got to be in a position to readily accept the light, and that once the light has been applied to your fatty cells, the adipose tissues, it releases the fatty acids, the triglycerides, the glycerol, and the water is released into the tissue by the application of the light. And you can picture in your mind about 1/8 of an inch of fat coming off, kind of like a cheese knife. If you had a block of cheese and you wanted to get one layer of cheese, you would use the cheese knife to do that. Well, everywhere you apply these paddles, around the stomach, on the love handles, under the chin, wherever you apply it, 1/8 of an inch of fat is going to be released, emulsified right under the red light. And that fat then is moved into the bloodstream, into the lymphatic system naturally. Now, we speed it up with something called the whole body vibration plate. Stand on this plate and it moves you side to side. That moves the calories into the bloodstream because it creates peripheral circulation. The blood supply is increased to the skin. There's fat trapped between the skin and the body fat, and that blood supply moves those calories into your bloodstream. So you burn the energy over the next 2 hours after you leave the treatment. So it's 2 hours before you come into the spa. You want to be hungry. No food for 2 hours. You apply the laser paddles to the area you want to shrink or reduce. It's 30-minute time frame. Releases 400 to 600 calories of fat. Now, in order to get it out of the body, we have to move it into the bloodstream with whole body vibration, little shaker plate, then drink plenty of fresh water to flush it out, and don't eat for 2 more hours. And that will cause that fat to be emulsified, to be absorbed, to be burned as energy and removed from the body. That is hugely important, because the only other way that we've ever been able to reduce fat without eating less and dieting and exercising is with procedures that either burn the fat, suck the fat out, cause it to change its viscosity, ultrasound, lipo, cavitation, radio frequency. All of these procedures can lead to pain and suffering. And the laser lipo that we're using doesn't have any of those side effects at all, which is why after 14 years, we're going on close to 7,000 people have been to the office, and lots and lots of happy people. So I'm going to let you watch this little piece because I think it'll pop up here. My name is Dr. Tred Rissacher,
and I'm the owner and the doctor at the Slim Body Laser Spa.
It doesn't get any
located
bigger.
here
I'm
in Stewart.
sorry.
You can lose 3 to 9 inches of stubborn belly fat in only 9 sessions or 3 weeks. Here are some actual pictures of some of my superstar clients. Call today. Take advantage of our Discovery Day special, slimbodylaserspa.com. Hit the contact page. I would love to help you.
All right, so that's pretty cool. So let me show you something else here. I'm starting to learn how to do this. I want to show you some pictures, some before and after pictures. Now, I could probably make it a little bigger here. No, I guess I can't. All right. Yes, I can. Watch this. Oh, I want to keep myself down in the corner there. Okay, so this is a client who lost 8 inches in 9 sessions or 3 weeks. This is the before picture over here, and that's the after. These little dark marks, those are the measurements that we measured him. So when you say 8 inches, divide each one of these dots, divide 3 into 8, and you get the girth, you know, the circumference. So this was about a 2-inch circumference difference. Now this is only 3 weeks. So let's look at another one here. That's the same patient from the front. And of course, on the left is before and on the right is after. Okay, so this is a 63-year-old female who had come in, and you can see where the belly was right over here, all hanging over her belt. And this is after 3 times a week for 3 weeks. This is what we were able to achieve. Now, yes, it looks like there's a little bit of loose skin still, but, you know, again, she was in her 60s. Skin tightening is better, but it wasn't perfect as far as that goes, but it is what it is. This is it from the side. And you can see it was remarkable difference. This is a suprapubic fold hanging over. It's called a panicula. And we were able to reduce it 10 inches, 3 weeks, laying on her back, listening to music. Really. Here's another one. Same 3 marks you see. 9 in. This is another 10 inches lost before and after. There's a suprapubic fold developing. Not anymore. Let's go through a few more of these. This is a man in his 60s. This is you might call that a beer belly. He lost 8 inches, 9 sessions in 3 weeks. You can see these are the marks. There's another client. Let's see. This is a pretty remarkable one. I wish you could see the arms better because she had a lot of reduction in the arm girth up here. But this is what we call back fat, and it accumulates over time. She was probably in her 50s to early 60s. This was 11 inches. You know, it was 3.5 inches in girth. And you can see these creases are much, much better. This is really, really hard to target if you're dieting and exercising, you guys. I mean, really hard. So let's look at another one here. It's one of my favorites. This is kind of what my stomach looked like when I did it. I had a big belly that stuck out over here, and this is after 9 sessions. He lost 11 inches. I lost 12. I was the same age as him, too. So it's very, very similar. And no, men don't get the panicula like women do. We get the ball, the big ball, I call it. All right, let's look at another one. It's not quite as dramatic. All right, so this is a chin. You can see how much the chin improved. Here was the before, and this is the after. And this was only after 9 sessions in 3 weeks. And yes, she is smiling because her whole face changed. She's very happy with that. So this is another, I think, quite remarkable picture here because you can see this crease. This is called a suprapubic fold here coming down. And after 9 sessions in 3 weeks, it's pretty much gone. That's quite amazing. I love that picture. It's awesome. All right. Now we got a little bit more time here. I want to show you, I had a client come in who was in his 50s, and he was he was at an event we came to. It was over at the Treasure, it was Martin County Fairgrounds, and it was the spring festival that the chamber had. And he was a business guy, and he came walking up in his nice, he was there as a presenter, and he came in. He said, "I want to get rid of my belly fat, and I just started out with type 2 diabetes, and let's try it." And he signed up. Well, he got some pretty good results, fantastic results. And he called me on my radio show is what happened. So from the radio show, I did a testimonial with him about how much it helped. And it was really quite amazing how much it helped him. And I'm looking for it here. Now let me go back to this, and because I know how to do this. There it is. All right. So we are going to click this. We're going to share this screen. And there we go. I'm getting pretty good at this. Thank you. All right. So this is a radio testimonial, and I'm going to let you watch this one as I fix my lighting. Doesn't appear to be playing. Oh, I know why. I think, well, all right, so we're not going to try to get that to work right. There's some. Well, there he is. There we go. Let's let him.
and a half reduction
Right.
just in one treatment.
And let's let people know what that means. You're measured in 3 spots, your belly button an inch above, an inch below. So that would be a ½ inch in 3 spots.
Correct.
Yeah. But it's still, you notice it, right?
Well, yeah, you as soon as I was done, the pants felt a lot
little
better. They
looser,
weren't as
yeah.
tight.
Yeah. And each treatment you had was kind of about a ½ inch or so. In those...
Approximately, because after 9 treatments, I lost a little over 7 inches total.
Okay, so that's almost about 2.5 inches in girth.
Yes,
approximately.
that would be about correct. I had to go buy a new belt.
Yeah, and without any strenuous exercise, no harsh dieting.
Nope.
Do you feel that if you did more treatments, you would lose more inches?
Oh yeah,
That's
absolutely.
Yeah. That's the other part about it. Sometimes, 9 sessions or 9 to 12 is enough to get kickstarted. I like to tell people, start with 9 sessions and see if it works.
Mm-hmm.
Get a feeling for it. If it works at 9 sessions, you are good to go whenever, because you can continue to lose more. I saw one gentleman who lost his entire belly. He had 42 treatments and it was spaced out over a year. And
wow.
I thought, well, who would do 42 treatments? And then after you get 10 successful treatments and you've lost 2 inches and you got 15 inches you want to lose, why not? And for me, myself, I lost those 12 inches in about 4 weeks, which was 12 treatments. And I continued to use the laser every week, probably since then. And that's what's keeping me getting thinner and thinner. And I'm using it more on specific areas that I'm, little pockets of fat, which are resistant to my new lifestyle. So what's really great about the laser, Brian, is it's very safe. And you can do it again and again and again without having any side effects or ill effects from it at all.
Oh, absolutely.
So eat, drink, be merry, and see the laser lipo guy, right?
Exactly.
But not the surgical one.
No, this
surgery.
Absolutely great.
Have you had any blood work done since then? Have they been back to your doctor to be examined?
I have. And just prior to starting the treatments, my fasting glucose was 138.
Wow.
And then
and normal would be about 90, is that right?
That's normal. But after just after the 10th visit, I had it taken again and I was down to 107.
Wow.
And that was a couple weeks ago, and right now I'm into the upper 90s.
Wow. Are you taking medicine too, Brian?
No, absolutely not.
There you go, people.
I was fortunate enough where I was getting ready to start taking medicine.
Yeah.
But this helped enough to where I don't even have to think about medicines now.
That's just a great story, and it, like I said, medicine. You know why medicine is so dangerous, Brian? Because it works. In other words, it works so well to a certain extent that people won't do things that take a little more work. And I was real quick, since I got you here, if you got a second, one of my patients, his name is Mr. Hernandez, and him and I had basically the same body fat amount about 2 years ago. He was one of my chiropractic patients, and I challenged him to lose weight. We were going to try to motivate each other to lose this weight. Now, he's a very successful guy. He runs a huge company in Dominican Republic, and he flies back and forth on his own private jet. So need I say more? He's got all the money available to him. And we had kind of made this challenge out, and I lost that weight as a result of the type 2 diabetes. And it actually started happening in November. I lost the weight in February, and he came back that spring to see me for treatment. And when I saw him, he looked bigger than when he left, and I was half the size. And you know what happened was in November, at the same time because he's the same age as me, he was diagnosed with type 2 diabetes, and he decided to take the medicine, which I suggest if that's what the doctor tells you to do, but he wasn't able to make any lifestyle changes. So as a result of taking the diabetes medication, he was put on stronger meds 3 to 4 months later when his body adapted to it. Your body adapts to it. So he needed more medication. And then when he showed up here in South Florida, I told him that I had the same onset. I was the same weight as him, but I chose to lose the weight, and the laser helped me do that. So who do you think's going to live longer? I mean, necessarily, I shouldn't say that for sure, because we could all die from things we don't know, knock on wood. But that's the different approach that people have. And
absolutely.
Right. And you took the approach to spend a little effort and time into getting some help for it. And you're not on medicine today. And I did the same thing. And I guarantee my buddy over in Dominican Republic, I bet he's on stronger meds. He might even be borderline insulin dependent now, because that's what happens. Once your body adapts to that medicine, you end up needing insulin injections too. And then you go into full type 2 diabetes with insulin. And it's really hard to manage your blood sugar, with a little machine every day, and thus you miss the mark. And that's why people end up with such serious health problems, because they can't regulate the blood sugar as good as your body. And then they end up having their vision problems and neuropathies, and they end up losing, they get a hangnail and their toe falls off because it won't heal because of the high blood sugar. So, and I don't mean to go into this in such depth, because this does not apply to us, but I think it's a great lesson for people to know that, if you're recently diagnosed with type 2 diabetes and it's less than 2 years, getting in and losing weight and changing some lifestyle can give you stupendous results.
Oh, I absolutely agree, because just prior to the treatments, I started getting the neuropathy in the feet.
Yeah.
And anytime I ate, I would get the tingling, go to sleep feeling in my feet. But
as soon as you got that blood sugar up, yeah.
Oh yeah, since the treatments, I haven't had one bit where my feet feel like they're going to sleep or the neuropathy at all.
So now you avoided being diagnosed with neuropathy and having to take Neurontin, gabapentin the rest of your life. You never have to take Lyrica, right?
Exactly.
You see that for the number. And you know what else affects blood flow? Your sexual function is affected by it. So no Cialis and no Viagra for you either, because you've improved your circulation. All those drugs are side effects of high blood sugar and circulatory problems in the lower extremity. Plus your balance, your ability to walk stably and feel the ground has a lot to do with, when you have neuropathy, you can't feel the ground. So you end up wobbling when you walk. You have to walk with a much wider gait. You see people with their feet spread apart. That goes away.
Yeah,
I mean,
stop looking like the old man walking down the street.
That's how you know it. That's how you, when I was actor in school, that's how you made yourself look like you were old. They said, separate your feet and walk with your feet separated, and you look like an old person right away.
Exactly.
Even in your 20s. Well, I just think that's great, Brian. I am very, very pleased that you got the results you got. I remember you vividly when I met you at the over at the fairgrounds, and you made, I talked to hundreds of people, thousands, but not many people really make the move like you did, and that you got to give yourself credit for that.
Well, I appreciate
you did.
that. Yeah, and it was the best move I ever did. So.
Yeah. And if you ever want a job at the laser spa, promoting, marketing, bringing this out to more people, because I know you're a very successful guy. You just look me up. I'm ready. I'm ready to expand. And with something
awesome.
like this, could you imagine how the world could change? That's how I saw this machine. When I saw it and I watched a guy lay on his back, he lost an inch in circumference in a 50-minute treatment in front of me in a chair. I looked at my wife and I said, if this thing really works, it could change the world. Look at that. Oh my God, And I bought the machine 5 years ago, $70,000. And
Nice.
I've used it and tried it, and it works, really does. And now I have 7 machines, 2 offices, and we're getting even better at it. Anyway, I know you got to go back to work, Brian. Thank you.
I do, and I appreciate all that you have done, and anytime.
Thank you so much. Have a fantastic day. Bye-bye.
Love that. Love that guy.
Righty there. I think we're going to take a break for a second, right? Can we do that?
Love that guy. Just great. One more. This is one of my favorite.
Hi, my name is Diane, and I'm here to share a little secret with you. I was driving home from the beach one day, not feeling very well about myself, and I saw a sign, Slim Body Laser Spa, and decided I wanted to check it out and see what it was all about. Now, I had tried a procedure one time to try to freeze fat. I mean, they actually took my skin and clamped it so tight and kept it in that position for a very long time, and it was painful. And actually had to stay like that for at least an hour. And afterwards, it was still painful when, the clamps came off. I did not want to do that again. But I still had my problem areas. So I stopped into Slim Body Laser Spa to find out what it was all about. And I was greeted by a wonderful, happy professional staff, very accommodating. I asked questions and they said, we can answer most of your questions with a little film. So I watched this little film and I did answer the questions. Where does the fat go? How long does it take? Is there any pain? And of course, will I get results? Well, I was told that I was they would warranty at least 3 inches off my body within a 9-session period. So that's 9 sessions, 3 weeks. I'm in. Okay. So I decided to do it. They walked me into a room. And by the way, let me tell you, it's beautiful. You go in and it smells so good. The air is just so fresh. And you walk into that room and it's dark and they just put you on a table. They put these little paddles on you, put them into place with a strap, and that's it. And what is the sensation? It's a warm sensation is all it is, less than a heating pad on you. It was amazing. Music playing. I was just so relaxed. I felt like a rock star. So I said, wow, all I have to do is lay here and I'm losing inches. And so that was it. I was within 10 minutes done with that. And they came back and shifted them around to put them in different areas for another 10 minutes. And after that, came back in another 10 minutes and shifted them. And it was a 30-minute procedure. After that, you'll dress and you'll go into a little room where they put you on a vibrating machine. This is the favorite. Remember the old-fashioned vibrators that you go on and they move you around? Well, it's a little easier. You're standing on it and it's vibrating and juggling loosening up all of your body fat. And then that's part of the procedure. So the whole thing took, I'm going to say 30 minutes for the slim body laser, and then the 10 minutes on the vibrator. And then as you come back, you can do 20 minutes. So within 3 weeks, 9 sessions, I not only lost 3, I lost 9 1/8 inches from my midsection. And let me tell you something, it was never going off. I don't care how much I dieted.
I love that girl.
I feel so good. I mean, my clothes have no bumps. I mean, it just fits wonderfully. I'm so pleased. Would I recommend this to a friend? Absolutely. It works. Best procedure.
I love that girl's testimonial. She says it so perfectly. So listen, we're having a great opportunity. If you've been watching this and you want to come in and find out more of what we do and have a treatment, we're having a canned food drive through the whole month of December. We did it in November and it turned out to be very successful. And we've decided to extend the food drive into the whole month of December. And what it means is there's a lot of people in our area that are struggling with food and to get fed, something many of us take for granted, but there's a lot of people that are very food insecure. And I mean, I call it being poor, and it's not their fault. It could be, but we got to help them. We got to help people. And the Jensen Beach Christian Church, which is in Jensen Beach, right behind that new restaurant, Lures. It's an old church, been there a long time. I was driving by one Saturday morning, and they had a food line. There was a line of cars that went all the way around from the Snook Nook all the way down Jensen Beach, down A1A there, and turned into them. And they had about 15, 20 people working there. And as the cars pulled up, they were putting in a box of fresh produce, cabbage and apples and vegetables and different types of foods. And people were lined up and they were doing this. So I pulled my truck over and I jumped out and I asked them what was going on. And they said, it's a food drive. And I asked if they could, I noticed it was all fresh food. It was no canned food. And that's really hard for people. If you don't eat fresh food in 2 or 3 or 4 days, you're done. It rots. So it's hard for people that don't have the refrigeration or don't have the proper means to keep fresh food. So I asked them, I said, do you ever do canned food or packaged food? And they said that they buy the food themselves and they get more per dollar if they buy fresh produce than they do if they buy canned food. So I thought right away, they need canned food, because sometimes it's going to save your life. You can put it in a car, you can take it with you, you can put it on the boat, canned food is critically important in emergency. So I set up a flyer and I did an announcement and we called it the canned food drive, 5 cans of food for a free lipo session. So if you donate, give us a call at the spa, Slim Body Laser Spa. And you tell them I'd like to schedule a donation to bring in 5 cans of food. You can get in exchange for that a free consultation and a free exam, which is nothing special. We do that for everybody anyway. But what is special is, as a result of that donation, you are eligible for a free laser lipo session. That's 1 session of our procedure in exchange for 5 cans of food. Now that's a $300 value. And we're going to extend this through December. We do have quite a few openings right now. Nobody, it's a little slow right before Christmas, but it's going to get busy in January, February. So get you set up. So with that said, you can come in, get the, here it is, show. There it is. Call today, schedule a free consult, 772-223-5885. Canned food drive has been extended. And yes, it has been extended. And we'd love for you to come in, check it out, say hi, check out the process. We're located in Stewart on East Ocean Boulevard, right across the street from the Fresh Market. On the way to Hutchison Island on Ocean Boulevard. We're next to Carmela's. So if you decide afterwards it's not for you, you can always go into Carmela's and have yourself a nice pizza or maybe something like that. I can tell you what I eat at Carmela's is not pizza. I have had lots of pizzas at Carmela's, don't get me wrong. But today at 63, by the way, I'm 63 years old. I feel good. I look good. I have energy. I can't say enough for the laser procedures. The laser has helped me with losing body fat. It's also helped treat my neuropathy. I have neuropathy too. And I used my laser. It's a different laser than the red laser. It's near infrared, which is called a deep tissue laser. And I used that on my feet. And that was probably 10 years ago because I had pain from the neuropathy and the laser completely erased the pain. I mean, within like 5 treatments, I couldn't believe how much better my feet felt. However, the problem did not go away. I ended up just without pain, which is a blessing, but I'm still working today on correcting that neuropathy. I don't know exactly where it came from. I had it before I had diabetes. I do have type 2 diabetes, and I am managing it with blood, with metformin and the glipizide, but I'm real conscious on my food intake. I've also invested in my glucose patch. You see it there? My glucose meter. And let me tell you, this thing is a lifesaver. If you're dealing with blood glucose and you're looking for help, you need to look at getting one of these glucose meters. It's a pretty powerful tool. I'll show you exactly how it works. I punch in my app on my phone which gives me my my blood glucose readings there. I think you can see it there. Oh, okay, and I hit this little plus button here, and it says scan sensor. So I do my scan, and what I do is I put this right on that. And there it is. It just read my blood sugar. And it shows my blood sugar right now at 165, which is kind of high. You can see that red spike, but you see how it's coming down? That's because I ate breakfast this morning, and I ate the right food. I didn't have any sugars or anything, and now it's going down on its own. And I can go back on any day of the week. I can go to yesterday, and you can see my blood sugar there. It was a little high yesterday. I was at the I was at a fair. It was an event, and I couldn't really. It was hard to get the right food for me, and yeah, it left me with a little bit of a high blood sugar. But then I had other days where it's gone really good. You know, it's gone down. So I'm pretty happy about that. Anyway, it's called a blood glucose monitor. It's helped me a lot. I also find that foods that I thought raised my blood sugar didn't raise it that much. It wasn't as critical. I thought I had to cut out everything, all the carbs. And then I found out there's certain carbs that I can eat, and it does not raise my blood sugar. But what always lowers my blood sugar, there's several things. Take the metformin, okay? But I don't like taking it all the time. I want to find another way of lowering it without the metformin because it tricks the body into thinking it shoves the fat into the cell, even, you know, the glucose into the cell. And I don't think that's a good thing, but it does lower the blood sugar, which is good. What always lowers blood sugar for me is drinking like a massive amount of water. If I gulp, you know, 2 big 16-ounce solo cups of distilled water, I like distilled water, that will, within 10 to 20 minutes, my blood sugar starts to drop every time. If I go for a walk, a good fast-paced walk, it always drops my blood sugar. You know, I've been doing this thing called rucking, and rucking is it looks like a backpack, but it's made with stronger material. And in the back of that backpack, I've put 30 pounds. I put 2 15-pound weights, fishing weights. I use them for sword fishing. And then I put that on my back. And then what I'll do is I live over on Indian River Drive, where we have the hill that comes down the driveway. And then what I'll do is I'll walk back and forth on that driveway, up the hill and down the hill and up the hill, with 30 pound on my back. That rucksack, I walk with that. And that puts a lot more, it burns a lot more energy than just walking without it. And when you burn energy with muscle, you're burning blood glucose. Just remember that. If you're burning energy by exercising, you are burning your blood glucose naturally, properly. So that's important. The other thing which helps with my blood glucose is getting a good night's sleep. Sleeping for the full, you know, for me, it's between 6 and 7 hours. That's usually enough for me. But getting the 7 to 8 hours uninterrupted, except maybe having a pee once at night, which is much better since I got my blood glucose under control. I used to get up sometimes twice. So now it's much better. That also lowers my blood sugar. So getting enough sleep, exercising, especially if I rucksack, you know, do the extra weight, and also drinking a lot of fresh water, gulping water, it lowers my blood sugar. So those are things I'm learning about it, and I would never have known this if it wasn't for this glucose meter that I got on my arm. My glucose meter costs me, it's expensive. It's $240 a month. My insurance will not pay for it, and so I pay for it out of pocket. I have a plan with NutriSense, and they send it to me every month. I get 2 of these appliques to put on it. It doesn't hurt at all, by the way. I don't even know it's on my arm. It has a very, very small, you know, needle, which you don't even feel it go into your arm. It has a little machine that you hold on your arm. I don't have it here, but basically you click it and it goes into your skin, and then you pull it off and it stays there. This little disc stays there. And I just put this piece of tape over it just to keep it from falling off. And, you know, I roll around at night a lot, restless sleeper. But that's where you do it, and you got to redo it every 2 weeks. It won't read after a certain time. It starts to give you error messages, which tells you it's time to change it. And then it takes about 30 minutes to rechange it, and then you get going. And I just realized that I must have put spelled my name wrong on my label there, Dr. Ted, T-E-D. So that'll give you something. Nobody's perfect. I'm near perfect, but nobody's perfect. So now you know about my blood glucose meter. You know how it works. You understand that we're having a food drive coming up this whole December. Please come in, abuse me. Come in, check it out. It's really, really, really powerful tool because by donating the cans of food, you're helping feed hungry people, and at the same time, you're helping yourself. So this is, I want to give you a few little things that I read here, and I'm going to wrap this up. I think my camera's going to time out. So here is some tips from a Dr. Mao Xing. And these are secrets of longevity. 100 things to help you with longevity, okay? So we're going to go over some of these because he's a smart guy. I think it's important to remind you of this. So, number 1, eat less, live longer. After analyzing the diets of about 100 centenarians, these are people that lived over 100, I found that the majority lived in modest circumstances. They ate less than the average amount, and some fasted at times because they were poor and simply had no food. Most centenarians surveyed around the world follow the 3/4 rule. The 3/4 rule. They stop eating when they are 3/4 full. Studies have shown that a reduction in caloric intake can increase life expectancy in animals. Why not humans? Now, this is a very well-known fact, and they have tested mammals, mice, and we're of the mammals. We're mammals. And if you can decrease their food intake 30%, you're going to get a 20% longevity compared to the ones that ate the same amount. So by cutting your food 30%, it can increase your life like 30%. And it's a pretty simple reason. The energy necessary to process excess food, it wears you down. It wears down your immune system. It wears down everything. So you don't want to be eating so much because the energy you lose trying to process the extra food, making extra fat, carrying the fat, these are all take energy from you. And this over time decreases your lifespan. And that's no good. So start out right now eating 30% less, and you will live longer. Here's another one. Smaller meals more frequently. Loading up our bodies with food 3 times a day is a cultural habit, not a biological need. Instead, eating smaller portions 4 to 5 times a day delivers a steady stream of nutrients, blood sugar, and energy to the body throughout the day. Less taxing on the digestive and metabolic systems, smaller meals prevent overloading and excess waste accumulation. Yet another benefit, dividing caloric intake in this way reduces your risk of heart disease. Now, spread out your meals, people. It's called a sippy diet. Learned it 20 years ago. It's called a sippy diet. And the sippy diet is eating small amounts spread out through the day, eating 30% less. And that's a great tool, something fantastic. Smaller meals more frequently. All right. Here's another one. Eat like a king. Eat like a king by day, like a pauper at night. Remember the famous saying, you are what you eat? It's also true that you are when you eat. Because of the human body's circadian rhythm, the same foods eaten at breakfast or lunch are processed differently than when they are eaten at dinner. Research shows that when you eat your daily protein and fat at breakfast, you tend to lose weight and have more energy, while eating the same things at dinner time produces tendencies toward weight gain, increased blood pressure, and heart disease. Listen, people, this is a no-brainer. This has become factual in my life and in all the people we work with at the spa when it comes to food and eating. That is, start your day with protein, not carbohydrate. Protein, protein, protein. A little bit of carbohydrate. Every day when I do these talks, people start the day with cereal, oatmeal, French toast. Breakfast foods are filled with carbohydrates. The only appropriate protein for breakfast seems to be eggs. And then they have a hang up. They think it makes cholesterol, which is not true. And you have some breakfast meats, some bacon and some ham maybe. Well, you need protein in the morning. And what it says here is research shows that when you eat your daily protein and fat at breakfast, you tend to lose weight and have more energy, while eating the same things at dinner time, proteins and fats at dinner time, which is really common, a big steak, it produces tendencies toward weight gain, increased blood pressure, and heart disease. Yeah, don't eat your biggest meal before you go to bed. Eat your biggest meal should be breakfast when you're getting ready and lunch. And then it should be cutting down in the evening. You don't have a big meal at night because that's when you're most sedentary. And that's when you go to sleep. And most people have just the opposite. They skip breakfast because they have their coffee. Lunch, maybe something they grab quick. Maybe they're working, maybe they're not. It's a lot of people skip lunch, or they eat a little bit before, a little bit after. And then when dinner time comes around, they're ravenously hungry. They eat way too much. And that's what this is saying. Eat like a king by day, like a pauper by night. And believe it or not, people that live in impoverished areas due to being poor, as long as they're eating fresh food, less of it, they live longer than people living in Western countries that have all the money in the world for all the doctors. I mean, that just makes sense. All right. So those are a few tips. I am going to wrap this up. I have some calls coming through. I got to go back to work at the office. I want to thank you from the bottom of my heart for taking the time to watch and to do this. I know it's gone on an hour and 33 minutes. I could keep going on, and I plan on it at another time. So this is Dr. Tred TV. And remember, we're having a canned food drive through the month of December, free consult, free exam. And if you qualify, you get a free laser lipo session so you could try it out. This is the time to do it. We're moving into Christmas. We're moving into the holidays. And let's make this thing happen, okay? I want to thank you so much from the bottom of my heart for tuning in. Love you a lot. Have a great day.